Bismillahirrahmanirrahim. My name is Abdullah Al-Khairi. I will talk about oxygen therapy. We have our objective. We will start with introduction, indications, complication, and finally we will talk about oxygen devices. Introduction. Oxygen is considered as a drug. Do you know why? Because if you overuse the oxygen, this will cause complication to the patient. And we will talk about complication later. So what is oxygen? Oxygen is a gas, is essential component of air and necessary element for the existence of living thing. It is colorless, odorless, and tasteless. So what is the indication of oxygen? The first indication for oxygen is hypoxemia. That means low oxygen in the blood. The other reason is labored breathing or dyspnea. The third reason is increased myocardial work. So what is the signs and symptoms of hypoxemia? We have tachycardia, dyspnea, cyanosis, and headache. And sometimes you will see the patient is angry. Just give him oxygen and he will be okay. So now we will go to the complication of oxygen. This complication happened usually when you use oxygen in high concentration. So the first complication here, we have the respiratory depression. For example, if you have COPD patient and you give him high oxygen, this will cause respiratory depression. The other complication we have atelectasis. If you give high oxygen, this will cause nitrogen washouts, and this will cause to lose the surfactant and will cause atelectasis. Oxygen toxicity. If you use high oxygen, this will cause to increased free radicals and will cause ARDS. The final complication is the retinopathy of prematurity. This will happen for a premature baby. So now we will go to oxygen device. We have two systems in oxygen device. We have low oxygen system and high flow oxygen system. The low flow oxygen system, oxygen delivery device that does not meet the patient inspiratory flow demand. That means the oxygen FiO2 will change from patient to patient depending on his respiratory effort. The high flow oxygen system provide all of the respiratory flow required by the patient at relatively accurate and constant oxygen percentage. So we will start with the first device here. We have the nasal cannula. As you see in the picture, this is the nasal cannula. You will put it in the nose. It is easy to use, comfortable for the patient. Patient can talk and eat, and it will deliver 24 to 40% oxygen, and we can use it from 0.25 to 6 liters per minute. And if you increase the flow, you will increase the FiO2. For example, if you put 1 liter, it will give you 24. If you increase it by 1, if you make it 2 liters, this will increase by 4% oxygen. It will come to 28. Okay, the other one, we have the face mask. Face mask will cover the nose and oral mouth. So this good for patient with mouth breather. It will deliver from 35 to 50% oxygen, and the flow we can put from 5 to 10. Never ever put flow less than 5, because it is required 5 and more to wash out the CO2. If you put less than 5, this will accumulate CO2 in the mask. Okay, the next system, oxygen flow, we have partial rebreathing mask. The partial rebreathing mask is this simple mask, but come with bag. There is bag here. This is a reservoir bag, and it will deliver from 40 to 70% oxygen, and we can use the flow from 10 to 15. You have to use more than 10 and more, so you can inflate this bag. The other device we have here, non-rebreathing mask. The difference between partial rebreathing mask and non-rebreathing mask is there is valve here, one-way valve. There is 3 valve, 2 in the mask and 1 between the mask and the bag. And it will deliver from 60 to 80% oxygen flow rate. And we will use a flow from 10 to 15. Now we will go to high flow oxygen system. We have the Venturi mask, or the other name of it is air internment mask. This will provide from 24 to 50% oxygen. The jet size and internment port determine the FiO2. That means this the internment port. If you increase the port, this will lead to enter more air and low oxygen. If you close this port, will cause more oxygen. Okay. We have now blender. Blender, this will deliver FiO2 from 21 to 100% and the flow from 2 to 100%. But the problem of this blender, you have to connect to oxygen pressure and air pressure. So, and usually this we use it for neonatal patients. Okay, the last one in high flow system, we have high flow nasal cannula. The advantage of this cannula, it is humidified and warmed air, and we can reach flow to 60% and the FiO2 reach to 90% also, and the patient will be comfortable in it. Okay, this device is very important to know the oxygen on patient. This device measures the SpO2 saturation of the patient, and this probe is non-invasive and can be attached to the finger, toe, or ear, as it is easy to use and it will measure oxygen. Okay, but if you use this machine, you have to be careful. Sometimes it will give you inaccurate reading. The reason of inaccurate reading, if the patient have low blood perfusion, if he have CO poisoning, if he have severe anemia, if he have hypotension, hypothermia, cardiac arrest, nail polish, dark skin, this all will cause inaccurate reading. So be careful when you use this device. And thank you.